Children's Hospitals and Clinics is being praised by the Minnesota Hospital Association.
Yeah, Children's won the Innovation of the Year award for making life less painful and a little less scary for its young patients. Take a deep breath. We'll show you how.
And you came here today to get some special pictures taken, right, of your kidneys?
8-year-old Sydney has been missing a lot of school because of persistent infections.
A lot of bladder and kidney infections. She's had way too many this year, 4 of them already.
To find out why, doctors at Children's Hospital want to take a look inside her bladder for clues. To do that, nurses need to insert a very uncomfortable catheter. Hopefully, what's flowing through this mask will make it a little more tolerable.
All you gotta do is breathe, okay? Nothing special about it. We're just taking some breaths.
Breaths of nitrous oxide, sometimes called laughing gas.
The nurses call it the I don't care medicine.
The nitrous is a big relief to Sydney's mother.
No mother wants to see her child in pain, so easier the better.
Nitrous oxide's been around for 150 years. Dentists were the first ones to put it into use for patient care, and it was a trip to the dentist's office that inspired Children's to give it a try.
So I was sitting in my dentist's office, and I was waiting to have my teeth cleaned.
Pediatric intensive care physician Judy Zier struck up a conversation with her hygienist about how well nitrous oxide works for young dental patients.
When you turn it on, you get the effects right away. Within 30 seconds to 3 minutes, the kids are feeling the effects. And it's not a deep sedative. Kids are still awake, but they're just more relaxed.
Children's Hospital is now using it for 20 different procedures, from inserting IVs to stitching up cuts, from CT scans to administering chemotherapy.
I wish we would have found it many, many years ago. We often wonder why we didn't think of it.
Radiology nurse Mary Kay Farrell first saw paramedics using nitrous out in the field.
And what I saw them using it for mostly was orthopedic injuries or trauma injuries to kids out in the field, and the kids would calm down.
Not only does Children's Hospitals now have nitrous oxide piped through its medical gas supply lines, portable tanks and regulators can be wheeled to any department where it's needed.
Here comes your mask.
Unlike deep sedatives, which can knock a child out for hours and be trickier to time, kids on nitrous are back to normal in 5 to 10 minutes. They can also take commands to help those treating them.
Just stay nice and still.
11-year-old Connor is battling leukemia, which means frequent spinal taps to monitor his cancer and to inject some of his chemo drugs. His mother says since the nitrous technique, Connor gets less sick, and it's been a marvelous comfort to both of them.
Good job.
Oh no, here comes my giggle girl.
While nitrous oxide is widely used for children in Europe, Dr. Zier says Americans have been a little slower to embrace it.
I think medical people don't look at it as potent enough, but if you target it to the right procedures and you have a program where the nurses work with the patients and provide that extra distraction, it's just a very powerful tool.
And interest in it is growing. Dr. Zier and her staff have hosted a nitrous conference teaching medical staff from other states. And how did they first learn it? Well, they took classes at dental school to get certified in its use.